Hello, my name is Frederick Arbuez, and today we'll be doing a head-to-toe assessment. I'm going to go ahead and start off with my tools. So I have my hand sanitizer for hand hygiene, I have my gloves, I have my cotton applicator, and I have my pen light in my pocket, and I have my stethoscope around my neck. We will go ahead and start off by ensuring my patient has privacy by closing the door or the curtains. We're gonna knock on the door. I'm gonna go in. I'm gonna perform hand hygiene. Okay, ma'am, can you please tell me your name and your date of birth?
Davina Arbuez,
And your date of birth?
7/22/1980.
Okay, perfect. Can I go and see your waistband there? Okay, perfect. The patient has been identified 2 times. Okay, today we'll be conducting a head-to-toe assessment. We will require some touching. Would that be okay with you?
Yes.
Okay, good. We'll go ahead and oh, and do you have any allergies that you're aware of?
No.
Okay. We're gonna go ahead and start off with the general survey. So I'm looking at her as I'm looking at her age, and her gender seems to be appropriate. I'm looking at her ethnical background and seems to match her skin color. I'm not seeing any acute signs of distress on her face. Or do you feel like hurting yourself?
No.
No? Okay. I saw her gait as she walked in. Her hand movements and leg movements were normal. There was no signs of twitching or irregular movements. Can you go ahead and tell me where you're at?
Long Beach, California.
Long Beach? Okay. Can you tell me who the president is?
President Biden.
Can you tell me who your dog is?
My dog is Snoop.
Snoop? Okay. The patient is aware, comprehensive, and there's no signs of acute distress. So we're gonna go ahead and start off with inspecting the head and the face. So I'm looking at her head and her face. Her contour is normal. Her structure is even. It's aligned. Her head size is normal cephalic. There's no signs of obvious abnormalities. So I'm gonna go ahead and check her hair. Do you feel any pain?
No.
Okay, there's no signs of pain. There's no signs of masses. I'm checking for any not lesions. Checking for infestations. There's no signs of infestations. Okay, I'm gonna check her submandibular joint, but before I do that, I'm gonna go ahead and perform hand hygiene once again and put on a new set of gloves. Okay, can you go and open and close your mouth for me? Okay, she's able to show range of motion on her mouth. Okay, I'm gonna go ahead and check for crevices. Okay, the crevices seems to be normal, no signs of crevices. I'm gonna palpate her maxillary and frontal sinus. Okay, do you feel any tenderness there?
No.
No? Okay, I'm gonna go and percuss. Okay, percussions are normal. Okay, I'm gonna go and check her eyes. Look at the ocular structure, it's nice and symmetrical. I'm gonna look at the eyeball, it's aligned. There's no signs of discharging or any redness. I'm gonna go and check her conjunctiva. Looking at the conjunctiva is nice and pink. Now I'm gonna test her for perla. Okay, I'm gonna dim the lights. And then I'm gonna go ahead and have you stare into the wall over there. Go like that. And check the left eye. Okay, both pupils are reactive to light and equal at 3 millimeters. Now I'm gonna check for convergence. Okay, go and look at this pen for me. Okay, both eyes converged in an axis and her pupils dilated as I brought the pen closer. So I'm gonna go and check her ears. Okay, I'm looking at her ears. Both ears are nice and symmetrical. There's no signs of redness or abnormalities. I'm gonna go ahead and palpate your ears. Okay, do you feel any pain?
No.
Okay, there's no pain. Okay, so now I'm gonna check in the internal meatus of the ear. Okay, I'm looking at the right ear, And I'm gonna look at the left ear. I'm checking for any discharge, bleeding, or obstruction, and there's none. It's clear. Now I'm gonna go ahead and check her nose. I'm looking at the nose. It's nice and symmetrical. It's even. There's no signs of obvious abnormalities such as nasal deviation. I'm gonna check both ears. Okay, both ears doesn't show any kind of inflammation, obstruction, or any kind of discharging. I'm gonna go and check her mouth and her throat. The lips are nice and moist. Okay, can you go ahead and open your mouth for me, please? The teeth is white. The buccal mucosa is nice and pink. I'm looking at the posterior and anterior palate. The anterior shows rugged with a little bit of white, and the posterior shows pink. Okay, I'm gonna use a imaginary tongue depressor. I don't want to trigger off any gag reflexes, so I'm gonna stick your tongue out for me. Okay, I'm looking at the tonsils. Tonsils that's a 2+. The ovulus nice and pink and no signs of swelling. Can I check under your tongue? Okay, tongue, there's no signs of masses. Okay, so now I'm gonna check her neck. I'm looking at her neck. It's nice and symmetrical. Her color is nice. It's nice and even. There's no signs of abnormalities. I'm gonna palpate the carotid pulse one at a time. Carotid pulse is present. And I'm also gonna palpate the whole neck. Do you feel any pain?
No.
Okay, there's no signs of masses or tenderness. Now I'm gonna check for her lymph nodes. I'm gonna check the occipital, postocular, preocular, submandibular, submental, and the 2 lymph nodes by your clavicle, and it seems to be normal. There's no signs of swelling. Now I'm gonna check her posterior thorax. I'm gonna have you sit up for me, please. I'm looking at the AP to transverse diameter. It's a 2-to-1 ratio. There's no signs of kyphosis, lordosis, or scoliosis. I'm gonna go ahead and palpate your back. Okay, do you feel any pain?
No.
Okay, the patient's not feeling any pain. There's no signs of masses. Her temperature is warm. I'm gonna check for tactile premises. So I'm gonna say 99 every time I do this.
99,
And
99, 99.
Okay, patient has no tactile premises. It's normal. So we're gonna go ahead and auscultate the lungs, starting at the left upper lobe on the apex, right upper lobe on the apex also, the middle lobe on the second intercostal space, then the left lobe on the second intercostal space, and then on the fourth intercostal space on the left, and then on the right, and then on the lowest, you're gonna go on the 6th intercostal space on the lowest lobe. Okay. Lungs are clear. There's no signs of adventitious sounds. We're gonna inspect her anterior thorax. The anterior thorax seems to be nice and aligned, symmetrical. There's no signs of abnormalities. She's not using accessory muscles to breathe. I'm gonna go ahead and palpate your chest. Okay. Do you feel any pain?
No.
Okay, there's no pain. I'm gonna go ahead and there's also no masses. The temperature is normal. I'm gonna go ahead and auscultate the anterior thorax, starting with the right upper lobe on the apex, and then the left upper lobe on the apex, and then the second intercostal space on the middle lobes, and then the right lower on the 4th intercostal space, the left lower in the intercostal space, and then the lowest lobe will be on the 6th intercostal space, and then on the bottom right intercostal space to the right. Okay, there's no adventitious sounds. Lungs are clear. So we're gonna go ahead and examine the upper extremity. So I'm looking at her upper extremity. Everything looks to be nice and aligned. It's nice and even. Her contour and color is normal. Hair distribution is normal. We're gonna go ahead and check her range of motion. Okay, so you're gonna go supination, pronation, flexion, extension. Okay, go ahead and push on my hand, and then push this way. Okay, patient shows strength of 5+. The range of motion is normal. Now we're gonna check for capillary refill and radial pulse. So I'm gonna borrow your hand there. I'm gonna check for radial pulse. Okay, capillary refill. And then I'll also do the same thing with both hands. Okay, capillary refill is at 2+. Radial pulse is present. Then we're gonna go ahead and lower the head of bed. We're gonna check for the heart and neck vessels. So we're gonna go ahead and have you lay down at about 45 degrees or so. There you go. Okay, so I'm looking at the contour of the chest. The chest seems to be normal. There's no obvious signs of abnormalities. It's all symmetrical. I'm looking at her neck vessels. There's no signs of distension on the jugular vein. And then I'm gonna go ahead and auscultate the lungs. I'm gonna go ahead and palpate it first. Okay, do you feel any pain there?
No.
No, there's no pain. Okay, there's no pain or tenderness, and there's no signs of masses on the chest area. I'm gonna go ahead and auscultate for heart sounds. So on the right intercostal space is gonna be the aortic valve. The left intercostal space on the second, on the left side is the pulmonary valve. The fourth intercostal space is going to be the tricuspid valve, and then on the fifth intercostal space, right underneath the breast, is the mitral valve. Heart sounds are normal. S1, S2 sound is present. I'm going to go ahead and lift your breast up for me and check for the apical pulse. Okay, apical pulse is also present. Okay, now I'm looking at the, inspecting the abdomen. Looking at the abdomen, I gotta look at it from my eye, and a level eye view. I'm looking at the contour of the abdomen. The abdomen seems to be normal. There's no signs of distension. There's no signs of pulsation. When I lift your shirt up here, towards the color seems to be normal. I'm gonna go ahead and auscultate first to make sure I don't disturb any bowel sounds. I'm gonna start with the right lower quadrant, to the left upper quadrant, to the right lower quadrant, to the right upper quadrant, to the left upper quadrant, to the left lower quadrant. Bowel sounds are normal and they're present. Okay, I'm gonna go ahead and palpate the abdomen. Okay, do you feel any pain?
No.
Okay, patient's not feeling any pain. There's no signs of masses. Patient's abdomen is also warm, as it should be. Now I'm looking at the lower extremity. Lower extremity seems to be normal. Both are symmetrical. There's no signs of obvious abnormalities. Okay, now I'm gonna have you push forward for me, and then pull forward. And then I'm gonna check for your pedis pulse. And then you're gonna check the range of motion. You're gonna go inversion and then eversion. Okay, range of motion is normal. Pedal pulse is present, and her strength is at a 5+. And also her hair distribution is normal. Everything looks okay in the lower extremity. So now I'm gonna check for neurologics. I'm gonna have you sit up for me, please. I'm gonna check the trigeminal nerve and check for sensations on the face. I'm gonna have her close her eyes and she's gonna tell me where it's located.
Forehead. Nose. Cheek. Right cheek.
Okay, patient's sensations on her face is normal. Okay, I'm gonna have her stand up and do the Romberg test. Okay, go ahead and close your eyes for me. I'm gonna wait about 30 seconds. Okay, that should be good. Okay, patient shows no signs of swaying during Romberg test. Therefore, she passes the neurological test. That concludes the head assessment today. Thank you for watching.